Is there any other ways you would recommend using this content, whether you're a student in your clerkships or if you're a faculty, how would you recommend it?
For me, one of the places I see it kind of being used is sort of how Dr. Cooley mentioned in terms of you're seeing a patient in triage. What is your differential diagnosis? Having that time period, even if it was a resident, if we had resident content too, but just to use it at that point to come up with your differential diagnosis and sort of speak intelligently about what you're learning and to feel confident. And to me, that's such a key point because so many times I feel that students know the information, they're just not quite sure how to express it. And I feel these videos provide a little bit of a baseline to confidently express what you've learned.
Same way I was using it on floors with my residents and students and going through a topic with them. It really helps them to organize certain things in their brain and they remember it a lot better. And I've also found that a lot of peer teaching has also been beneficial for students. So our fourth year medical students teaching our third years, our interns and residents teaching our juniors, and our chief residents have used Osmosis as well as some podcasts during their Friday with the students to really branch out different topics and help the students remember things for their shelf exams and their steps.
How I could see this being used for the surgery clerkship, one thing is for preparation for cases. So oftentimes, for elective cases, they'll be assigned to the case the evening prior or the day prior. And so, it can be used as preparation. If they're going to go into some type of pancreatic resection, maybe they want to watch the chapter on or the video on pancreatic diseases or whatever the case may be. And then a second thing I can think of that would be helpful in the surgery clerkship also is kind of like an assignment or homework. If the student really doesn't have a lot of baseline information on that topic, I can give the student an assignment, like you go watch this video and then come back tomorrow and then you're going to share what you learned and then we're going to expand on that. We're going to discuss that rather than me having to explain it to you from the very basics. You watch the video, that's your assignment, that's your homework. Come back tomorrow and then we're going to talk about what you learned and then we're going to add to how is this video that you watched relevant to the care of the patient that we're currently taking care of.
Start a conversation to learn more today.